tonight. Now, the police in KwaZulu-Natal have arrested hundreds of suspected rape and domestic assault suspects. In November alone, more than 230 suspects were arrested for rape in the province. According to the police, alcohol has significantly contributed to the commission of these offences. Now, joining us is Vincentia Dlamini, Operations Manager and Forensic Nurse at Women and Men Against Child Abuse. Very good afternoon to you. Thank you so much for joining us as we try to assess those numbers to get an understanding as to why we continue to see those numbers growing. A number of driving factors that have been attributed, including alcohol, societal norms when it comes to violence with intimate partners. What are some of the issues that you have noticed as a department?
Thank you for having me. And first of all, I would like to say that alcohol cannot be the only contributing factor in terms of these crimes that have been committed. But we do acknowledge that, the use of substance does play a major role, but also a lack of inhibitions because a lot of offenders offend sober. So we cannot really blame the alcohol alone. But also the gender stereotypes, people thinking that if you have a girlfriend, by virtue of them being in a relationship with you, it means that they owe you, So those gender stereotypes that we need to address, we have opportunists where they meet women who are going to be working at night alone, and they find an opportunity to actually commit these crimes as well. So it is a number of factors that do contribute to the scourge of rape, and knowing that a third of the victims are children as well. It is that vulnerability that is there. We were observing the day for disabled persons yesterday. They also become vulnerable. So it is a scourge that has been ongoing, and we do commend any efforts, to fight this scourge. If there's more arrests that are going to be done, we really, really commend, and we need public participation and public engagement and accountability. There's a whole lot that we need to put in place so that we can get the results that we want. Because first of all, we know what happens when arrests have been made. It does not only end at the arrest. So you can find that there's hundreds of these suspects that are going to be arrested. But what happens from arrest to, to the end, because they are going to be arrested, but they sometimes, when the bail application happens, they don't even know the bail conditions. And when they find the suspects are being, granted bail, they didn't know about that as well. And then when they meet them, sometimes they get threatened by the suspects, and they decide to withdraw from the cases. And after that, if it does go into a prosecution, there's a number of cases. Sometimes, there's a lack of trying to locate the victims, and cases are withdrawn. Sometimes there's a lot of corruption. So it's a number of factors.
Yeah. What I hear you say is there's a number of loopholes within the criminal justice system that is not able to hold to account these perpetrators and making it very difficult for victims to come and report. I was just looking at the numbers of convictions when it comes to gender-based violence, both from women and men, including children that are being abused, and the numbers seem to be very low. What is it within that system that needs to be plugged in terms of ensuring that there's enough evidence, there's enough people that come and report, and that there's conviction when it comes to these cases, outside of all the interventions that we've already seen from government?
All right. First of all, we need to start within our homes. When children do, say that they've been abused, we need to take the necessary action to actually go and report, because some of these rape cases, they happen within homes. So we start at the homes, and when they go to these community service, those are our police stations. When they go there, the frontline officers need to be sensitive in actually making the environment, because we know there's victim empowerment rooms in stations, but we still find that there is secondary abuse that is happening when victims are just going to be made to wait for hours. This has been spoken about, for years. And after that, it's not only police officers. is the medical personnel that is going to attend to the victims, to take evidence, to be sensitive, because we avoid, secondary victimization, and the sensitivity around how they give them access to healthcare, when they are given their post-exposure prophylaxis, being committed in taking the necessary evidence. We don't want a situation where victims go there and then the samples are not properly taken, or they are not given their prevention, and they are also not attended to in terms of preventing unwanted pregnancies, sexually transmitted infections. And after that, when they go to court, are our courts sensitive enough to are they protecting, because we know the system is not victim-centric in the sense that everything that happens, it's not in favor of the victims. So they still have to go through this, and sometimes some prosecutors are not even friendly to engage with the victims and tell them what's going to happen. Sometimes they have never even had a meeting with a prosecutor. The first time they'll see a prosecutor is when they go to court. But as to what is going to happen, what is expected to them, there's issues around, did our victims get court preparation to get prepared? Because it is a very hostile environment where people are very scared of the court. So do we have those services? Our forensic labs responding quicker to giving us results in terms of the samples that were taken? The system can drag a lot. Do we have presiding officers where a magistrate or a judge decides, I'm not going to take unnecessary postponements when they deal with defense attorneys that are going to come with delaying tactics? So that, because it's a financial strain on the victims, it's an emotional strain on the victim, and it's a lot of things where parents have to miss work, children have to miss school to attend court cases. But the unnecessary delays that happen, the facilities that needs to be there. Is the stenographer working on the day when they have to go there? So do we have enough interpreters? Do we have, all the resources that we need to make the process, go smooth for the clients? But we know it's not happening because these are different departments, and we have challenges with different departments. You can have an awesome investigating officer, but as the victim just decides to go to court and it's stressful for them, they may decide that they are tired of this and they decide to withdraw. And what is it doing? It's actually allowing the abuse to go on, because the offender feels that they can continue because there's no repercussions, for their actions. And the repercussions not only for suspects, but also for people that are entrusted to actually do what needs to happen.
Absolutely.
You'll find that
as we get into the festive season, Vincentia, sorry to cut you off there, just very quickly, we understand this is a very high-risk period for people that are victims of gender-based violence and even domestic violence. You have family members that are fighting over finances, over where to spend their holiday. Children are also involved in that when it comes to custody battles. What kind of advice would you give to somebody who's watching right now who could find themselves in that kind of a situation, or perhaps they know someone who is in that kind of a situation, how they can protect themselves and what kind of recourse they can take to ensure that they see through this period alive?
Okay, I think when they find themselves in the situation, when they go to police stations and they don't get help, the cases are not open, it is their right to request that they want the station commander. The station commander is accessible to the public at all times. So people must not fear having to escalate matters. They could also use organizations like ourselves, and there's other organizations that are standing against, gender-based violence. You have your POA. You do have other organizations within communities that play an advocacy role, in a sense that even though when you know what needs to happen, but the service providers aren't providing the service that is required. So you need to use the resources that are there for you in the community. You can go onto our website as well and actually ask for advice. It is festive season. We've got a resource list of where, when you feel distressed, we've got numbers for your South African depression and anxiety groups, where people who have gone through trauma and they need immediate trauma debriefing at that time. You have your lifeline, you have your childline that have got helplines. So people need to not keep quiet about it. But also as adults, we need to remember our responsibilities when it comes to the children around us, that we have a legal obligation to actually report cases of rape, and that we have a legal obligation to protect the rights of our children. You need to, when you know that a child has been abused, but you knowing that a child is abused, you carry a responsibility to protect that child. And also the sense of community. When we know as communities, we should not keep quiet, because these acts continue in the communities because we keep quiet about it. We allow the offenders to do as they please, to torment the community.
Yes, very important to have the whole community involved in ensuring that everyone keeps safe. It's not always easy, but it's definitely worth a try. That's Vincentia Dlamini, Operations Manager and Forensic Nurse at Women and Men Against Child Abuse. We'll have to leave it there for now.